Hospitals are also sanctuaries. They're not mandated to question the person's citizenship or health insurance status, and you and I pick up the tab.
I went to the emergency room. I broke my arm, local hospital where I was born, and 43 people there. No one spoke English. No one had health insurance. They had interpreters. They had free medical care. Most people weren't sick. They were just kind of headache, depression.
In my home state of California, 86, think of that number, 86 hospitals have closed.
Because the hospital's been recapitalized 3 times, broke.
2004 to June 30th, 2005, our gross billed charges for foreign nationals was $15 million.
$15 million.
$15.4 million.
In this one hospital.
Yes, and our payments for that total was $518,000.
When I talked to the doctor, he said that very few people of the 40-something were ill, but they used him as their general practitioner. They got wonderful care. Nothing was asked of them. They didn't have to know the language. They didn't have to have any money. They didn't have to have health insurance.
You and I would have to fill out paperwork. You and I would have to show proof of insurance.
You and I would get stuck with the bill afterwards.
Then we would get stuck with the bill.
How many surgeries have you had, Angel?
I got 2.
2?
Yeah.
Did you have to go to the hospital in an ambulance?
No, they take me in a helicopter, take me at the UCLA hospital.
So the doctor's nice to you?
Oh yeah, I got a nice Chinese doctor, yeah.
Undoubtedly, if somebody goes into the emergency room without insurance, that they cost the hospital more than the average person does. Again, you go back to the federal law, which is EMTALA. Because of EMTALA, all hospitals have to treat anybody that comes in through the emergency room.
Whether or not able to pay, whether or not legal.
Civilized society, that should be the policy, that should be the way it works. Somebody's in need, and you have the resources to help that person in need, then those should be put to use.
And when you have an absurd situation like that we're doing so much for people here illegally from Mexico, and yet the more we do, the more we feel that we haven't done enough. I don't know what to say, it just creates a sense of despair.
Pues es un abuso, yo pienso que es un abuso. Hay muchas clínicas donde le permiten pagar cierta cuota y si la persona obviamente no tiene dinero, puede uno pagar una pequeña cantidad para que lo puedan revisar. Pero eso de no pagar nada, eso es muy abusivo de nuestra parte.
And people from Mexico don't have prenatal care, and he gave me the example of a woman who'd come in her 3rd trimester from Oaxaca, got wonderful health care for 3 months. And he said only in America would somebody walk across the border without getting any prenatal care at all and have a wonderful doctor himself shepherd her through her pregnancy.
And this, my darling friends, is an unfunded mandate. That means no money comes in for all the treatment and the services, but if the practitioner and if the emergency room refuses to treat, there is a fine up to $50,000 per patient.
Are spreading disease and reintroducing diseases that haven't been a part of American society in decades. What are your thoughts on that?
Well, you know, it's very difficult to contain the R word, and I do believe that many of these people are racist. Anytime they begin to look at a minority and say, oh, they bring in disease, well, I already know where they're coming from.
They bring in diseases that we never see here.
Immigrants are exactly like every other human being. Some of us are well, and some of us are sick.
Virtually all of the diseases I'm going to be discussing are what we used to teach in tropical medicine. Because they were the things that we would never see here in America, but now we do. First, multiple drug-resistant tuberculosis. 84% of the patients with MDR-TB are illegal aliens from Mexico and the Philippines. Chagas disease is right here in Cochise County. In Latin America, Chagas infects 18 million people every year. You all remember leprosy from the Bible. It used to be called the disease of the soul. You all read about the Chi-Chi's restaurants, also again another shit disease. Literally, 3,000 people were exposed to die right outside of Pittsburgh because of illegal aliens who didn't know their bathroom etiquette, who then came into the kitchen and dealt with the salsa and also illegally imported Mexican scallions that had been fertilized with human feces.